Anybody have any questions besides what we've been talking about? I'm gonna go over your question again so everybody hears it. She asked if I ask you a question and you respond to it, do you still have to respond to a classmate? The answer is no. All you need is 2 total responses. Whoever you respond to is fine, whether it be me or a classmate, but it still needs to be in the same format. So if you respond to me, it still needs to have a peer-reviewed article, be a paragraph, whatever. But you don't have to respond to me and another classmate, either or. Any other questions? How'd y'all like activity last week? Let's talk about that a little bit.
The in class.
On Thursday.
Yeah.
I need feedback.
I like it.
We're gonna do more.
I need to see.
I like doing activities.
I do too.
So you like it?
So because it helps me understand when I'm not to know and how to understand.
Yeah, it's give us different scenarios or what to do if in case we're in this situation. I like it.
All right. Anybody else?
Yeah.
Good. Okay. We'll have different ones throughout the course. Just trying to get some feedback. All right, we're covering chapter 4 this week. Organizational behavior. Does anybody know what that is, or have you taken any psychology classes that deal with organizational behavior? No? Nobody's taking psychology?
I took it.
You didn't talk about organizational behavior?
I don't think so.
It deals with, obviously, the organization and the way people behave in the organization. So it's really the study of people and how they interact with other people in a work environment, in an organization. As I just alluded to, it touches on psychology, sociology, communication. Those are all disciplines that it touches on because they all deal with people and the way they interact with other people. So organizational behavior happens at several different levels. First, we have the individual level. And at that level, we're dealing with perceptions. Everybody has their own perceptions, attitudes, and assumptions. Are we all clear that these are 3 different things?
Yes.
Give me an example. What is an example of a perception?
How you see something?
All right.
Yeah.
How you see something. All right. Give me an example. What's a perception that you have?
Because somebody's an E7 in the Army, that means they've done well. That is a preconception because
Okay. All right.
to make right nowadays.
I'll take that one. All right. Attitudes.
Pessimist, optimist.
Pessimist and optimist. Attitude. All right. And then what about assumptions? What your example is might be an assumption rather than
An
a perception.
assumption. Okay, perception.
So we'll go back to perception.
Well, it would be perceived that he was a good soldier, even maybe he wasn't. Right? Is that not a perception?
Well, the perception would be he's a good soldier, period.
Oh, okay.
Now, the assumption might be he's a good soldier because he's been in the Army for whatever, 10 years. That might be an assumption. Does it make sense now? All right. So then the next level is group level. So we could say that we're a group, right? Collectively, we're a group. So within the group, you'll have leadership, teamwork, and decision making. So if we think in terms of leadership, and this is our group, give me an example of leadership. Should be an easy one.
You.
Right. Instructor, professor, whatever, leader. All right. Teamwork.
Group work.
Group work. We're working together right now. We're having a conversation collectively, throwing out ideas, and decision making.
Choices.
Choices. You're making a decision to collectively, as a group, we're making a decision to pay attention and discuss this, or just kind of look out the window, right? And just kind of do our own thing, right? right, so that's the second level. And the third level is collective. So can somebody give me an example of what a collective level would be? Our individual would be us, ourselves. Our group would be this group within the classroom, and what could collective be?
All together.
All together, but what's an example?
Like,
FTCC,
Yeah.
right?
All the classroom.
FTCC would be a great example of collective. It's the entire school, everybody all together. So within the collective level, you have work structures, organizational systems, organizational culture, and organizational learning and adaptation. So a work structure might be the HMT program. So within FTCC, we have different programs, which we could consider as work structures. We have dental program, nursing program. Those could all be considered different work structures. Organizational systems, what do you think that might be?
The way they work together.
Right, the way they work together. While we all have different disciplines, at some point or another, we have to work together on certain things, right? You know, I'm the chair of the HMT program. I may have to work with the chair of the dental program. We may work together on student retention. How can we keep the students in our programs? Let's work together, let's share ideas. So yes, that's a great idea, great example of organizational systems. And what about organizational culture? What might that be?
The different races, backgrounds.
Not exactly.
Yeah, I don't know.
environment.
Organizational culture deals more with, you know, the word culture alone, you're correct, deals with race, whatever. But an organizational culture is how they do things. It's more informal, things that may not be written. So an organizational culture might be, and for this we won't use FTCC as an example, but there may be some organizations where people just walk right by each other and don't say a thing. That's a culture. They don't speak to each other. You may have other organizations where people walk by and they say, hey, how you doing? How are your kids? Whatever, you know, that's a culture. So every organization is going to have their own culture. But that's what organizational culture is. It's kind of unwritten things. How the organization is. What's that organizational personality, per se. And the last thing is organizational learning and adaptation. What might that be?
How you learn and adapt.
How you learn and adapt. So give me an example. Let's go back to FTCC.
Training on their like policies. And
Training
stuff.
on their policies. That would be organizational learning.
Culture training.
Every year we have to have training and we have to do professional development so that we're up to date on the changing laws and whatever is related to our school and our state. And what about adaptation?
How you adapt to the environment.
Right, so give me an example.
Like as far as knowing the classes, where the classes are, where you sit, what's comfortable, where you at.
All right, but think more on an organizational level. What might FTCC be adapting to?
Following procedures.
I'm sorry?
Following the procedures.
Follow procedures, but what else? You were right about external. So let's think in terms of organization.
With people, how many students they have.
How many
to be
students
able
they
to
have?
accommodate.
What just happened within the past 5 years that may have caused a huge adaptation at an organizational level at FTCC?
Did they shut the nursing program down at one of the colleges for a few years?
Okay, that might be an example. I'm thinking of something way bigger than that though.
I was here 5 years ago.
And days for reassignment, that's another good example. I'm thinking something much bigger.
Graduation, people not graduating.
That's a good example.
Is that something to do with the?
Think in terms of the external environment. What's been happening in the past 5 years?
Job loss.
Job loss. What might happen with job loss? More people gonna come back to school, right? So those are the types of things that, as an organization, FTCC may have had to adapt to. How might they have had to adapt? More classes. If more people are coming back to school, we have to adapt. We have to offer more classes. We have to offer more class space, more buildings. We have to hire more faculty to adapt to things that are changing in our external environment. Does that make it more clear? So again, to recap, you have 3 levels: the individual, the group, and the collective. So if we think in terms of, we've been using FTCC as an example, just because it was an easy example. But if we think in terms of healthcare, and we're thinking still in terms of an external environment, these are the types of things that might affect our organizational behavior. So number 1, rising costs and declining reimbursement. How might that affect us as an organization?
If it costs us too much for, say, a patient or something to go to the hospital, they're not gonna go.
They're not going to go, and then in turn,
Can't afford it.
what's that domino effect going to be?
The hospital's not gonna make as much.
Not going to make as much money, so what might happen?
They're not gonna be able to hire their staff.
Not going to be able to hire or what?
Pay their staff.
Maintain their staff. We may have to cut, right? So that's one. Increased competition. We have it right now where people are building new hospitals. That's going to increase the competition. That might affect our organizational behavior. Again, we may have to hire more staff to remain competitive. We may have to offer new services or change the services that we're offering. Consumer demands. You mentioned something about the basis. I think it was you. Base reassignment. So we may have more consumers in the area that are demanding a certain type of service, whether that be orthopedic or chiropractic or whatever that might be. New services, outpatient care, chronic illness. People are getting sicker, more cancer. That's going to affect how we have to adapt as an organization. Quality of care. Now you can go on the internet and look at different hospitals and compare their level of care. What kind of pressure is that on an organization?
A lot. because
Transparency. They can see everything now, right? How you're performing. If you're the bottom percentile and the hospital across the streets up here, it's a lot of pressure on you as an organization, right?
We just came from Michigan, and you could actually log on to the emergency room and see how long the wait was for each hospital.
You can do that.
Oh, can you do that?
I don't know about Fayetteville, but you can do it in Raleigh.
Okay, yeah, I just knew in Michigan when I just moved from Detroit, that you could log on and it would tell you, hey, this one has a 38-minute wait and this one has a 3-minute wait.
Yeah, and as time progresses, you're only going to see more of that. And so that's also going to affect consumer demands. The more consumers can see, the more they're going to expect. And those are all pressures that, from the outside, that might affect our organizational behavior. Now, if we look in terms of our organization, these things could affect us. Professional workforce. If we think about our workforce, and if they're progressive, more people are coming back to school to get education, that's going to affect our organization, right? How? People might expect more pay. They're getting more education. Again, we're having to adapt to figure out how we're going to adapt to that. Technical expertise, same thing. People are getting more education, more experience, more licenses, more certifications. Again, we have to adapt. Cognition. Cognition deals very closely to organizational behavior. Does anybody know what cognition means? First off.
How you understand something?
It's mental, deals with the mind. And so, obviously, how people behave is closely related to what goes on in their mind, right? How they think. And so, some mental processes include what you notice, how you process that, and what kind of meaning you create from it. So, let's think back to first day of class, right? Each of you came into class. What did you notice? Give me any example.
That you were the head of the department.
No, what did you notice?
Oh.
Not what you heard or learned, what did you notice? Observation.
Your advisement.
That it wasn't going to be as easy as I thought it was going to be.
What did I notice? A yellow wall.
Well, that's not what you, that's what you learned. That's not what you noticed.
Okay. Yeah.
It wasn't a lot of students.
Wasn't a lot of students. Okay. How did you process that information? Once you noticed that, you had to think something after that, right?
Yeah.
What'd you
Either this
think?
class was
Be
hard.
honest. Be honest.
Like, I don't know.
Yeah, we have the
Maybe
head
it
of the
wasn't.
department and she's gonna be very hard, or?
Yeah, well, again, hold on though. That's not a notice. That's something you learn. This is a good example.
Well,
You came in, you noticed that it was a small class. So after that, something had to trigger. You thought something. Go ahead and say
It
it.
might be a boring class. Thought that
All right,
was
so you might think it's gonna be a boring class, right?
Right.
We'll go with that one since you don't want to give us an example. But you don't tell me.
It's not boring.
All right. So we walked in class. It was small. We processed that information into thinking that it was gonna be a boring class, right?
Right.
We gonna go with that example?
That's
I
what
would say a
everybody
hard class.
I didn't think that.
All right, what did you think?
They didn't want to.
What did you think?
What did you think?
What'd you notice on the first day?
I really honestly noticed that you were there.
That I was nervous.
You noticed that what did you notice outside of yourself?
The technology in the classroom.
All right, you noticed okay. You noticed the technology, and from then, what did you process with that information?
That we would probably be able to, like you put it on Blackboard, we can go back and review our lectures.
Okay, so
It's not just a one-time.
So you noticed the technology, and you process that information into meaning that it would be kind of a technical
Beneficial.
class.
Okay.
Yeah. It would be
Okay.
I noticed
beneficial.
it seemed more laid back. Not
So you
like a
noticed the
laid back
environment. You
yeah.
noticed the environment, that it seemed laid back. With that information, what did you process?
More one-on-one.
More one-on-one, okay. All right, so you get where I'm going with this.
Yeah.
Just through these examples. When you notice things, your mind doesn't stop there. It keeps going. It's gonna process what you noticed and then put it into meaning. So a mental process handles information. It controls the perceptions because you're having perceptions when you notice things. And the behavior is based on that. So let's go through this again. If you walk in class and you see that it's a small class and you think that it's boring, how might that affect your behavior?
Negatively.
Negatively. You might not come to class anymore, right? If you think
might
it's
not
gonna
be
be boring.
interested.
How else might it affect your behavior? You may come to class and not pay attention because you've already thought that it's gonna be boring, right? So what you process in your mind directly affects your behavior.
Not necessarily.
Not necessarily. All right, give me an example. We're open for debate.
Because I thought it was going to be boring, but I still do the work because I come to class.
All right, so you're saying that you came to class, you saw that it was a small class, you thought that it was going to be boring, but you still come to class and you still do the work. So you don't think that what you thought directly affected your behavior in any way at all. So you don't think that on the first day, if you came in and you saw the class was small, but you thought anyway it would be a cool class, that you wouldn't be more engaged?
I thought I would be more.
It depends
engaged.
on the
I
person.
thought it would be a
Yeah.
harder class, and I enjoyed, because you had the syllabus up the first day, you had the Blackboard up.
I
Okay.
like that it was a small class.
So you said it depends on the person. You're right, it might depend on the person, but remember that every person thinks differently. So it is gonna depend on the
So
person
that's why I said not necessarily.
and how they process things. And that's why I said I'm open for debate. We open for debate at any time. If I say something and you like, Dr. Haynes, like, speak up.
What I
So
thought
it's
that
not
when I
like
came in,
1,000-word writing assignment.
No, you can't say on today.
I like the fact that it was a small class, and I was thinking there was less people had to speak in front of me.
Yeah,
Okay.
that's true.
So that made you more at ease,
Yes.
more comfortable.
Yes.
Okay. All right. All right. All right, so we went through all of that because there's a cognitive model of behavior that directly deals with organizational behavior. So I gave you some examples here, and how the process works is there's a situation and the task first, then the thinking happens, and then the behavior. So examples of a situation or task are interpersonal relations, workplace cues, problem solving, or industry environment. And the next step would be formation of assumptions, perceptions, beliefs, biases, cognition principles of knowledge. And then the end result is going to be reactions, decisions, work tasks, learning, adaptation.
And then too, it can depend on the teacher too.
Oh, you still on? So you depend on the teacher.
Because some teachers, they just sit there and talk. They don't
We
try
were
to
still
interact
stuck
with
on you
students
with
more,
that
like,
again.
to get them to stay focused and stuff.
But my question to you all was, before you even got to the teacher, my question was, what did you notice when you came in? Now, when you came in and you noticed, you couldn't tell how I was going to
Yeah,
be
because you
before
was
I
already
said
talking to
anything.
another student from another teacher. Like, most students don't do that on the first day.
All right, so outside that, had I not been in the class and you came in and you sat down and everybody was in here without knowing the teacher, you still would have observed something.
I would have
You
observed
still could
read
have
that
observed.
syllabus
You
on
could
there,
have
and it was
observed the syllabus. You still could have observed the class size. So with or without me or the instructor being there, you still would have formed some type of observation, right? But you're right. Some of it is going to depend on the instructor, and that kind of goes with interpersonal relations and workplace cues. If we use this model as an example, we can go back to our example of the first day of class.
Do you know whose model this is? Is it like, because when I pulled my article, it had like Maslow's theory.
Well, this isn't Maslow.
There was like 15 different ones. Do you know if it was?
Well, the chapter you're thinking about, this is a different chapter.
Okay.
It's chapter 4. I think that was chapter 3.
Yeah.
With all the different theories, right?
But there's not a certain person that came up with this organizational.
No, I don't think so. I mean, at some point, I'm sure the book doesn't reference.
Yeah, I was just wondering, like, when we're doing research for our next writing assignment.
How could you reference this? You could reference it from the book.
If we could look up the person that came up with this theory.
Well, it's not really a theory, though. It's more of just a model. But we'll look more into that. We can look more into that later. If we get back to our example of the first day of class, and you said that you saw me talking to a student, right?
Right.
So that could have been the situation or task. That could have been the interpersonal relations. And you said that when you saw me talking to another student, you said what? What'd you just say?
You don't remember?
You said you came in, you saw me talking to another.
Most teachers don't interact with their students on the first day.
All right, so let's hold it right there. So that has moved us on. You started thinking. Right? You started thinking. So that was an assumption. And a perception, right?
Right.
Both. Well, the perception was the fact that you said most instructors don't talk to students on the first day. That's the perception. But then you probably formed an assumption,
Right.
which was,
Like you might be the same.
What you gonna, that you interact with your students.
I mean, that you might be different, excuse me.
Different teacher than the other.
Than others.
right, and that would be an assumption that I'm a different teacher than other teachers, right? So did that affect your behavior?
Yeah.
How so? Was it a reaction, a decision, a work task?
Decision.
Decision. What was your decision?
Mine's an adaptation.
We'll start here. What was your decision?
I was trying to help her out.
Oh, trying to help her out. You don't have an example.
My decision was after I saw that syllabus that I was going to have to work my tail off because with all the other classes I had.
Okay. So that was a conscious decision that you would have to work hard.
It wasn't going to be as easy as I had presumed when I signed up for the course.
Right.
I
But your
think my-
behavior was to make the decision
Mhm.
that I'm gonna have to work hard. All right. Well, in your example was you said it was a reaction.
I think my decision would come last. Because I would have to learn your techniques in person, adapt to it, to know if I want to work hard or not work hard, right?
Well, you can. It could be both. It could be more than one. So
Okay.
yeah, it could be learning. You could have been adapting and reacting and making a decision. But my point here is that if we use the same example of coming in on the first day, you went through each of these steps, whatever it may be. It could be different for everybody in this class, but you did at least one of these, right?
Right.
In this model, you went through it. Now, has your behavior changed from day one? From what your initial behavior was to what it is now? You're still working hard. All right? Anybody else? Anybody change?
It's more relaxed. I'm more relaxed. You're always more relaxed after you get the first day of the work.
So your behavior has changed. It's more relaxed.
Yes.
Okay.
I'm OCD, so no way. I try.
Like in class, not with the work.
Oh,
Just
yeah, in class. Yeah,
In
it's
class.
more relaxed. It's
Because
more.
we get
So your behavior in class has
Mhm.
changed. Okay. Anybody else?
With me, I get more at ease each class, right, as it progresses.
So everybody's relaxing,
Mm-hmm.
moving towards relaxation.
No, Lila, she's overwhelmed.
I am. I get overwhelmed so easily. I do.
All right, so we have some thinking patterns that are directly related to organizational behavior. So first, if we think in terms of individual, each of us personally, these are some thinking patterns we have. Assumptions, perceptions, biases, expectancies, schemas, framing, and mental models. Can we all agree that we at some point do all of these?
Yes, ma'am.
Now, what was your perspective on the first day?
Oh, now you asking me questions. How brave of you? How brave of you?
What did you think of us? What now?
My perception on the first day, you guys were very, very quiet and very shy and timid. So I was wondering, had you talked to other students and had they told you something bad about me? Because you guys seemed very afraid, very quiet. My last class, 110, was very outspoken. Even on day one, they were very.
I didn't rate my instructor on you.
They were very energetic and chipper, and you guys just kind of came in and were just very quiet, and I was just like, what have they heard about me?
Well,
Okay,
first you
right.
got to
Have
be
you
quiet
seen
first, and then that's why I said.
I'm
I
scared
like
of
that.
woman.
I have to.
Most FTCC instructors have really good
I have to
reviews.
Yep.
observe.
So that was my,
That's why I said I had to adapt first, and then make a decision.
that was my first perception. You guys were quiet, so I was wondering how much you would interact in class, if you were going to be quiet the whole class, or if you would loosen up throughout the semester.
So you thought it was gonna be boring because we were
You know
quiet?
what I'm about to say. No,
I didn't say boring. I didn't say boring. I said quiet. The class will never be boring with me. But I thought
Is that what you thought? You thought it was gonna be boring?
She put you on the spot right now.
Or did you think we had no clue what we were getting into?
I did.
I just thought you guys were really quiet.
Because
So
I
did you
know a
think
lot
it
of
was
us
gonna be
had not
boring?
taken any.
But you don't.
Well, I expect, this is an intro class, so in my mind, I'm already expecting that many of you will come in here not knowing anything about healthcare, and that's why this class is so important to me, because this is a foundation. So I have to provide a good foundation for you all on healthcare management, because a lot of you will come in here not knowing a thing, and I'm your first impression. So if I give you a bad impression of healthcare, what are you gonna do? I'm going to the dental program.
This
I'm
was
going to the
my
nursing program.
decision-making class between nursing and business side of healthcare.
Yeah. So I don't expect you guys to know much about healthcare management.
So how has your decision changed since first day of school?
How has my decision changed? Well, you guys are more vocal. So my perception perhaps was not accurate as to thinking that you guys would be, shy or quiet because you guys have become more comfortable. So my decision has changed a little bit, or my perception. My decision is basically the same.
Based on our
My
grade.
perception has changed.
Your decision is based on our grade?
No, my decision is going to stay the same regardless.
Oh.
My decision is to provide you guys with the best learning environment as possible, whether you're quiet or not. That decision is going to stay the same. All right, so we also have thinking patterns between individuals. And they include the expectancy theory, self-fulfilling prophecy, attributions, framing, mental models, and sense-making. Has anybody read the chapter yet?
I reviewed it.
Be honest, if you haven't read it yet.
I briefly looked over it.
So are you a little bit familiar with any of these?
I need to answer the
Like
question.
the attribution. Go ahead.
What does schemas mean? I'm sorry, I don't.
You tell
I'm
me.
individual. I don't.
So you haven't read the chapter?
No, I haven't.
All right, somebody who read the chapter,
Schemas?
let's talk about schemas.
Oh, gosh.
Or if you just have your book.
You be scheming.
Scheming?
That's what I would think about.
To
Underhand?
dictate one expected scripts from how certain events unfold.
Let's
Taking final exam, interviewing for a job, that's what it says in the book.
Hmm?
let's repeat that so everybody can hear.
To dictate one's expected scripts for how certain events should unfold.
So basically, like, if you think of this person a certain way.
And it also defines appropriate and inappropriate expectations for social category. of the event.
And the examples you gave was taking a test and,
If your grandmother bakes cookies, professor should grade them fairly. That's what one of the examples is.
right. Does that make sense? No?
Can you give it in a more,
It characterizes a person's certain traits.
oh,
Right. Everybody clear on that? Give us an example, besides the book, a better example.
Okay, so like, my trait, I'm OCD, so, and that's a personal trait, right?
Yes. Well, that would be under here, on the individual side.
Oh, okay.
If we're thinking in terms of between individuals, can you give me an example? No.
Maybe I'm always a little overbearing when I'm
Yeah.
in a group because
Right.
I am
Exactly.
OCD and I try
Exactly.
to do the
And that's a
research
trait that you have, right?
beforehand. Did y'all find that last week that I was a little overbearing?
She's not gonna say yes.
Well, I want to be honest, you
She was
know,
like, come on,
because I'm not
like,
used to group
wait.
activities.
She put you on the spot,
yeah,
huh?
she was like, I'm not.
did.
Okay, I'll be honest. Some things you were.
Yeah, I mean,
I could tell she does have to. Some things she would.
All right, so let's stay with that example. This is good.
So it's
if
good
we-
she know. So when she get it in, she know what she's not doing.
If we thinking in terms of the expectancy theory, and you said that you have OCD, and this is between individuals, so we could use your group example. Expectancy theory might say what? Considering your behavior or your attitude.
that they expect me to know already.
They expect
Even
you to
though-
know everything already?
Even though
to
maybe
them.
I had not done that actual research.
Right.
So,
And that they're not gonna just expect that, they're gonna expect you to be on top of things, for you to turn everything in on time that you have to do, all based on how you act or your behavior. Right?
and I really don't mean to be so pure in my group, I'm sorry, I've tried.
No, everybody has their own characteristics.
Everybody understand that? So again, you'll have different thinking patterns on an individual basis compared to when you're interacting with other people. But both of these relate to how you work with other people in an organization. Now, if we think in terms of individually how we think, this can obviously affect how we understand things. Assumptions. We go into the workplace with assumptions. Let's see.
Can I give you one?
Yes,
I work at Church's Chicken, right?
you work at church. Well,
Church's
we
Chicken.
won't give a name.
No, we ain't gonna do names.
No, we won't give the name of the.
Well, I work
establishment.
somewhere else.
You worked at a place.
But
Okay.
basically, it's nothing but black people. So when people come in here, they get the assumption that we can't work together. Or, this is assumptions, because we get comments from other
Customers?
customers.
Okay.
And that we're not professional. That's an assumption.
Okay. And what happens a lot of times is that some people who form these assumptions start believing that it's true, right? If we use your example, certain people may assume certain things about certain races to the point where they'll start believing it's true. Now, perception is what you notice. We kind of talked about this when we used the example of class, and to what attention that's paid. So if we go back to your example, they walk in, the first thing they do is perceive. They notice that everybody
we're not dressed
there,
the way we're supposed to be dressed, or
Or
what's coming out our mouths.
Yeah.
right,
It's not professional.
Right.
And stuff like that.
and then they form that assumption that you guys, don't work hard or not professional, et cetera, et cetera. Then you have cognitive biases, and we all form these. And these are mental processing that simplify handling information, but it might compromise your decision making and the quality of that. So what that means is we all have certain biases of certain things, right? Let me see if I can give you a good example. I might have a bias of certain people that work here, right? And that might be because, you know, they worked here for a long time, or they're in a certain position that's higher than me. And so I may have a bias. I may, you know, sometimes as employees, we may allow certain people to say things that we wouldn't allow somebody else to say because of their position. We're not gonna talk back to our boss, right? But if our coworker says X, Y, Z to us, we might see them in the parking lot after work, right? Hopefully not, but it could happen, right? And all of that deals with the way that you're handling that information. And that bias might affect how you make that decision as to how you're gonna behave or what you're gonna say or how you react.
But when you're in a workplace and you got a person that's above you, aren't you supposed to tell them how you feel, but in a well-mannered way?
You tell me.
Some people get offended.
Some people get offended.
But you're still supposed to let them know, and so y'all can come to agreement in a situation.
Well, we have a big difference between what you're supposed to do and what actually happens, right?
Some people
You might.
But say you're doing what you're supposed to do, and you go to.
But is that according to you, or according to, is that an unwritten rule? Is that a policy?
That's what I'm asking.
That you just.
It's going to depend on the organizational culture. You'll have some cultures or some organizations that have an open door policy. You can come into my office anytime, express how you're feeling, give me feedback. You may have other organizations where you don't have that open door policy, and dare you not step up and speak your mind because you might get a pink slip.
It's not tolerated in some organizations.
So while you may be supposed to speak up, you don't want to jeopardize your career or your job, right? So it's important that you get a feel for the culture to see. There's been times where I can't speak my mind. Sometimes you just gotta, you know, hold it in because you never want to jeopardize yourself. You never want to shoot yourself in the foot, as some people say. And that deals directly with the organizational behavior. Once you get a feel for the organizational behavior and the culture and the unwritten rules and how they interact with people and how they do things, you'll know if it's okay to speak up or if you just need to hold that until you get home and express it then.
Okay, what was your assumption when you came here to represent? Since you're not.
I think it's still too early to say. I don't want to form any biases or any preconceived notions because I haven't had enough time yet.
How long have you been there?
5 months.
Oh. Wow.
So for 5 months, what have you?
We still got a long way to go.
Of Fayetteville in general, that the traffic is terrible. We don't have enough shops.
Oh, the traffic is nothing.
Yeah,
Oh, it's nothing?
From Atlanta.
She's from Atlanta. That's way heavier. That's
Well, traffic ain't nothing.
It's bad in Atlanta.
Yeah.
Oh, yeah, it's nothing compared to, you came from Atlanta.
All right.
You came from Detroit, but.
Sense making sense of something. When organizations can come together and make sense of a situation, these are the things that can happen. There's obviously an opportunity for them to improve on something. Hindsight is 20/20, right? If there was a situation where unfortunately there was a harassment case or something that happened in an organization, after it happens and they have made sense of it, they can say, wow, we should have had security, you know, or we should have had tighter security, or we need to install more cameras, or whatever it may be. A lot of times, sense making can be very opportunistic because it allows you the opportunity to improve on something for the future, to make those changes different.
What was that? There was one day on the news when it didn't make sense that they said it was going to put security guards in schools, but they're not going to have any weapons. So, what sense does that make to put them in school?
I think in that sense they, you know, are trying to deter people, or they think that putting people there, it may, you know,
They're in every Cumberland County school already.
keep people from.
They're also trying to save $1 million.
No, I'm just saying, on the news, like, when that thing happened, they started saying they was going to put security guards in school, but they're not allowed to have any weapons.
I thought the sheriffs in Cumberland County carry weapons.
But that's here, we're talking about in the other states.
In other states.
I have a question. This is dealing with healthcare though.
Right.
I read on the internet that if you don't get the flu shot in certain states, they're firing you.
If you work in healthcare.
Yeah,
Work
in
in
a lot of places, is if you're working, even when I was working in the hospital and I had no direct care of patients, I had to get a flu shot. Didn't want to get it, don't really like the flu shot, but it was something I had to do.
Yeah,
That
unless
doesn't-
you're allergic to that, whatever the egg
Yeah.
is they use in it, and then you have to mask every time you walk in someone's room.
Yeah.
That's not nothing ethical or in any way wrong.
Well, you can
You get
choose
what I'm
not to
saying?
get it, but you have to gown before you go in their rooms, correct?
But some hospitals are just straight out firing or giving them their pink
They can
slip.
see it as non-compliance.
Yeah, that's what I'm.
Yeah. I'm sure for those organizations that are doing that, it's written somewhere that
Even if it's
they
against
probably
their
had to
religion?
sign off on.
Does religion come into play in healthcare at all like that? Because I know a lot of religions don't take.
I'm sure it's on a case-by-case basis. I'm sure there may be
They
some
don't take any
exceptions
kind of-
that apply, but for the most part, yeah. That's something typical. Most hospitals are gonna, or healthcare organizations, period, are gonna require you to get a flu shot. Because they're thinking about customer. Customer's always, first priority, so they wanna keep them healthy and safe. So there's 5 disciplines of organizational learning. You have system thinking, you have a common identity, team learning, surfacing and challenging mental models. And basically what this means is, we've talked about sense making, and what organizations have to do to piece by piece, especially after things happen, and how they come back in retrospect and look at what's happened in hindsight. And in an organization, when something happens, you need to be able to process it and not just allow it to happen. You need to think about each step and what happened, cause and effect. Those type of things are the types of models that you want to encourage in your organization. You want to have everybody in the organization participating in system thinking, thinking about how things can always be improved, how we can better serve our customer or our patients. So as a whole, the organization should be constantly thinking and going through those mental processes and that cognitive learning to make sure that we're continuing to improve. How does some of that happen? Communication. We have a sender and a receiver. I might be the sender, you might be the receiver. It can go the other way. You can be the sender, I can be the receiver. Of course, there are some barriers that arise. How might they arise? If I'm the sender and you're the receiver, it could be my behavior that may cause a barrier. If we go back to that example, first day of school, came into class, I wasn't talking to another student. I was just quiet. I was, didn't have a smile on my face. My behavior was very cold and not warming and welcoming. That might form a communication barrier, right? From that point, just based on my behavior, first day of class, everything I had to say could have totally been cut off. You couldn't have listened to anything I said just based on my behavior, right? From sender to receiver. All right? It could be your behavior as a receiver. I could have been, I could have came in, I could have been talking to a student. I could have came in with a smile on my face. Could have been doing everything, welcoming, warming. But your behavior, you may have come in tired, sleepy, in a bad mood. That might create a communication barrier, right? You might not want to listen to anything I have to say. All right, so that's that one. The third one, from the organizational setting. You come in, you're having an okay day, you're doing fine. I'm here, I'm all right, I'm smiling. But you may have such a bad perception of FTCC, right? Could create a barrier, right?
Yeah.
That would be the organizational setting. So, it's very important to understand that to have good communication, the sender and the receiver have to be on the same page. The behavior has to be there on both sides. Otherwise, there's going to be a breakdown. There's going to be a barrier in the communication. So if we have great communication, that means we can have pretty good problem solving, right? What that involves is, first we got to identify the problem. And then once we identify it, we can think about what's the cause of the problem, what the goals might be, and what our options are. Problem solution. We're looking at our different options. We'll choose among those options. Hopefully that's a good one. And then we'll implement them. And then we'll evaluate them. So let's take an example. What's a problem we have right now?
10 minutes between classes.
10 minutes between classes. Great example. What's the cause? Location, right? Distance. So we got to set a goal. Our goal will be what? Obviously to arrive on time. Right? Let's think about options.
There's none.
There's always options.
Leave a minute early.
It's not really an option. Walk faster. Yeah.
Run.
Run, right? One option.
Yeah.
Drive.
You get parking.
It's an option though.
Oh, yeah.
It's an
I guess
option.
It would be an option.
Any other options?
Illegal parking.
Yeah, they got me out of class for that last night.
Not going to class. Is that an option?
No.
It is an option.
It is an option.
It's an option, right? All right, so out of our options, we've assessed them. We gotta choose one.
Walking fast.
Walking faster. All right, so we decided we're gonna walk faster. So Thursday, you gotta walk faster.
I run as it
That's
is.
just use this as an example. If we were to implement our option, we would be implementing walking faster. And then if we wanted to evaluate it, how would we evaluate it?
Did you make it to class sometime?
Did she make it? We
Was it an
would evaluate if she was on time. Good example? Problem solving. We'll stop there because we're out of time. See you on Thursday.